But what I found over the last couple of years is that we all kind of define presenting in front of a group a little differently. So I just want to make sure in terms of CMS regulation and compliance that we're understanding exactly what we mean and how things need to be filed a little differently depending on the topic you're discussing. And then we'll talk about what you need to do as an agent to make sure that you're doing the right things, presenting to the audience in the best way, and driving traffic to your events as well. So I'm gonna keep on moving. I don't even have to introduce myself. All of you, you did that for me, and congratulations with remembering my states. I'm not even sure that my own leader knows which states I have, so good job there. It definitely usually means a lot of travel for me. So it's been an odd year of being inside my house versus driving all over my 4-state territory. Well, let's jump in, and I typically am long-winded, so I'll try to keep myself honest and under time, leaving us time for questions. So if I go too quickly through something, please don't hesitate to slow me down. But what is a sales seminar? I kind of put these things in 3 categories: educational, informal marketing, and of course, sales seminars. So each of these has a really specific need and a place. And I think that agents who are wanting to do sales seminars should also be doing the other topics here. So looking at educational first, this is a meeting you're holding where you are providing information without talking about any sort of plan benefits. So this is a Medicare 101 is probably the most common. We have a full Medicare 101 presentation that you can present. These topics are a fantastic thing to do to start a new relationship with a place. And I do have a slide that talks about some of the types of places I would recommend for these types of things. The next bullet down, programs in a box. Humana has about 70 different presentations we have already prepared for agents to use that are beyond just Medicare topics. My favorite one to give when I was a sales agent myself was scams that are normally targeted towards seniors. It goes through a series of 5 different scams that are more likely to be aimed at our population that we work with and how to avoid them. That was extremely popular, and it really brands you, the agent, as the expert in both Medicare and other topics that are near and dear to the hearts of our members. You can also bring in other people like doctors or nurses or something like that if it's a topic that maybe you're not as comfortable, but you feel like it is good information and will continue to shore up those relationships with the people in your communities. The next one, informal marketing. This is one I'm seeing a lot right now. People at like the state fair or food pantries, anywhere that is letting you in, a health fair, to have a booth or a table. These are filed events that do allow you to talk about specific benefits, but you're not selling. So you could hand out marketing flyers, promotional items. You can collect permission to contact people, but you're just not going to pivot from marketing to sales in those events. Now, of course, our topic for today, a sales seminar, is targeted towards one specific plan. So you are only talking about the Gold Plus HMO in Peoria, and you're not going to discuss any of the PPO's benefits if that's the plan you chose. So we're choosing either in person or virtual to gather a group of people together and talk about product with the goal of enrollment in the plan. And you can collect applications at that point. So are there any questions so far that I should stop and talk about?
Courtney, I just keep going. We'll filter some questions as they pop up there for you.
Sounds good. Okay, so firstly, in order to be able to prevent a sales seminar, so I'm kind of putting away the educational and the informal marketing for the rest of the presentation, but to be able to present in a sales seminar environment, the first thing you've got to do, at least with Humana, is certify to present in a seminar. So you can see on the right, I took a screenshot inside of the Humana Vantage portal. We have Market Point University. That's where our training is for certification every year. That's also where we keep our seminar authorization course. It is currently out there for plan year 2021. So you could take it now if you wanted to, but in my opinion, I would say go ahead and just hold off until after we roll out the 22 plan years. That way you don't have to do it twice, although it is pretty quick. If you have never taken that course before, or you didn't take it last year, you will need to meet on a one-on-one basis with either myself or our management team, or your counterpart in whatever state you are in, for the broker manager or senior manager, to do a face-to-face, or you could do it virtually. And that is so that we at Humana can make sure that you understand all of the regulations around sales seminars and you know how to present compliantly. It's kind of a covering ourselves and covering yourselves. We do not have to approve an agent for this. So I have never turned somebody down, but because that we talk through any problems that may come up. Usually what we try to do is have you present a plan to us just to make sure that you're using the right words and not saying things like, oh, this is the best plan in the area. We know we can't say that. So it's a good system to make sure you're doing things the right way. So if you don't know who your broker manager is or your senior managers, I am very happy to help you guys find those people so you can go through and get seminar certified. Once you are through the seminar certification process and you're approved to present, we need to get the event filed. So we need to know the information on the screen. We need date, time, location. Of course, you are the presenter, so we know who's going to be presenting. If you're going to do them virtually, we need the meeting URL, and we have to file them at least 21 days in advance. If the date of the presentation is within 21 days, you cannot do it. It has to be filed first because CMS needs to know when they are, so they could secret shop if they so choose, which we will talk about here in just a minute. You also don't want to start inviting people to the event until it has been filed. That is a CMS regulation, and we definitely want to make sure we're doing the right things there. Also, you want to make sure you have all of the required sales materials. So this is a list. I pulled this straight from our training. So this you'll see again in the seminar certification course. We provide this to you in a PDF as well. I don't expect everybody to remember everything that I'm saying. This is kind of just an introduction to it, but you want to make sure you have the sales kit for sure. That already includes most of the other points on the screen. So it has the summary of benefits, it has a star rating. You do not have to have a scope of appointment for sales seminars. It's not a requirement for somebody to enroll if they attended a sales seminar presentation. But as it says on the screen, if they decide to follow up and enroll later, then you would want to get a scope of appointment. The drug formularies are also in the sales kit, so are paper applications. So you're really pretty good if you have brought sales kits for everybody. You've already really gotten ahead of yourself and you don't need to put together a lot of other things. One other thing I will say, and it's in all caps, is the sales presentation video. These should be part of your sales presentation process anyway. You likely all already heard the current sales presentation video. You definitely want to show that at the beginning of your sales seminar because it hits on most of the points that are required for you to say in the secret shopper checklist. So they will show up with a clipboard and a pen and go check down the list of all the things that are required. And if you're showing the sales presentation video and the sales kit, you are pretty good to go. I think some of this is a little bit remiss, but I feel bad if I don't say it. You of course want to show up early and make sure that the space is available. I have had scenarios where the room wasn't cleared and prepared for me to show up to an event. That's no fun, and you don't want members to be coming in when that's happening. So making sure you get there early, all of your technology works, which we know technology is finicky, and that doesn't always like to work. Light snacks, I think that's a good thing to have, some refreshments and light snacks, but you cannot serve a meal. So if you are doing a sales presentation, you cannot serve dinner or lunch or something like that. You also don't want to, you want to avoid any food that could be perceived as a meal. Like I've had people ask me about hot dogs. That's a snack to me, but it's not a snack to everybody. And that is a touchy area. So just make sure it's definitely construed as a light snack. And then a sign-in sheet. I recommend it, but it has to be optional. You cannot require somebody to sign in or give you any information at all when they're attending your sales seminars. I apologize if you can hear any background noise. I did let my husband know I would be presenting right now, but apparently now is the time to work on drilling drywall into my basement. So I apologize if you can hear that. So do's and don'ts of sales seminars. I'm going to go through these bullet by bullet because I don't want to skip over anything. Normally I don't like to read off a slide, but I am going to touch on each of these. So of course, identifying which plan. You want everybody who comes into the room to know exactly which plan they're there to hear about. If they ask about other plan options, that's, it's not something that you can talk about at that point in time. Even if they're oh, I want to sign up for the PPO. Well, unfortunately, we identified the HMO. We can't talk about that right now. You can't market the sales seminar with anything that's not CMS approved. So you're not going to want to type up an email saying, hey, come to my Humana seminar. We have plenty of things to help you market the event that are already CMS approved, so you don't have to create anything yourself. I already mentioned bringing laptop projector speakers and plan materials. And then we will talk about how to present the plan in its entirety, explain how an attendee can look up their doctors and their drugs. You don't necessarily have to look everybody's up for them, but you want to make sure you're talking about how they can tell if their drugs and their doctors are covered. And then, of course, you can schedule follow-up appointments and light snacks and all of that. You cannot require registration, as I mentioned, even true if you are doing it virtually. You cannot make them give you any more information than their name. So you're not going to be making them fill out anything to do with their phone number or address or anything like that if you are doing it virtually. You do not have to require a scope of appointment. It is not necessary for a sales seminar. You cannot ask for referrals during a sales seminar. Of course, you can after when you're doing the follow-up appointments, but not during the actual presentation. And using unapproved marketing materials, you cannot ask health questions. This one comes up a lot, and I get a lot of questions around, okay, how am I supposed to look up their doctors if I don't ask questions? You can invite them to tell you whatever they would like to tell you. If you would like to tell me your medication list, I'm happy to look it up for you once I'm done presenting. But you can't say, who's your cardiologist? Or do you have a cardiologist? Because that can give the group an impression of cherry picking, and that is a CMS no-no. So you can invite anybody to tell you whatever they would like to. And then absolute statements, as I mentioned, you can't say things like best or this is the greatest or anything that is a declarative statement that is, definitely yes. You can say this plan has XYZ benefit or the lowest premium because those are proven to be true. But best is dependent on the person and what their needs are from the plan. Yeah, any pressure or incentive to enroll also. You don't want to say, if you don't do this now, you may never be able to get the plan. That's a pressure scare tactic. CMS does not like that. And it is very specifically outlined on the CMS secret shopper checklist. So I know I kind of covered a lot of information there. And I'm happy to talk any of this over to. Again, all of this is provided to you in the sales seminar authorization course as well. So it will give you a list of the do's and don'ts in that material as well.
Courtney, a couple things.
Sure.
We mentioned that we can't file for a seminar with 21 days or less. Is there a maximum time? I mean, is there a preferred time, maybe a month out? What's the parameters on if I want to schedule something 2 months in advance, is that too far in advance for Humana to put on the books?
Great question. Thank you for asking that. So you can file events, I actually don't know if there is an outwards limit, but what I like to do for any of my agents who are doing, let's say there's a new plan rolling out in an area and somebody wants to roll their whole book of business. I've had that happen. So we'll schedule all of their sales seminars through the entirety of AEP. And I typically try to do that with them in around July, August, get them done early. So they can be a couple months out even and through AEP, that's okay. I don't know if there's any, you wouldn't probably want to schedule something next year.
I'm sure that this is in the authorization course, but do we go to the Humana website to file that seminar?
Thank you for that one too. We will file it for you. So you would just come to me with it. So, or your counterparts of the broker managers, and we will take care of filing it. Usually I have a event request form, and that's true for informal marketing and educational. If you want to do an event, I'll send you the form to fill out and we'll take care of filing it.
In addition to that question, how about ordering materials? Do you have a time frame on when materials should be ordered in advance of that seminar?
So I believe, and for anyone's AEP, we release plan benefits in July. So July 14th is actually the date that we're going to be releasing our 22 plan year benefits. And it is prior to September. I recommend everybody try to get their sales kit orders in. So for somebody's sales seminars, if you're doing a sales seminar, I'm going to probably know about it, and I'll more than likely take care of ordering those materials for you unless you already have them. If you've already placed your order, that's okay. But we definitely want to place that order well in advance. If you're thinking of doing sales seminars, do that authorization course early, get them planned early, and let's get those ordered in early September at the latest.
Thank you.
Great questions. I appreciate those. And I do have the ability to place orders for agents, and I do that typically if agents are, really write a lot of business for us. I try to take care of that in late July and through August. But if that's something you want help with, please don't hesitate to reach out. So when you are all set up, you're ready to let her rip and present the benefits. Of course, as I already kind of mentioned, explaining to them which plan, talk them through what they're going to learn today. So you're going to say, I am sales agent Courtney Stowe, and today we're going to talk about the HMO. Start by playing a video, and then I'll explain the plan to you and go from there. All right, put it in bold, play the sales presentation video. I can't stress that enough. Don't skip it. Play it, because you don't always know if somebody is a secret shopper with CMS, and if you skip that part and you miss one of the things on there, CMS could come down on you for that. So we absolutely never want that to happen. If something happens with technology and you can't play the video, you should pull it up and go through slide by slide and make sure that you are talking about everything that is in the video. We also have flip charts that are a paper version of the video. I think that it's just a much less user-friendly experience if you have to use the flip chart, but I have had to personally use it myself because I couldn't get audio to work. Even after I had already tested it, it wouldn't work, so we did the flip chart. That is compliant, it's just not ideal. Then from there, just like you do in all of your one-on-one appointments, you've got to talk through the entire summary of benefits. So line by line, premium, deductible, max out-of-pockets, doctor, hospital, everything that's in the summary of benefits, including the extras, which technically speaking is not required, but that's half the reason the people are there usually. Talking about drug coverage, things that we don't normally think offhand, talking about prior authorizations, talking about where they can get their medications. If they're, with Humana Medicare Advantage plans, you really can go to most pharmacies, but I know some others, have preferred or non-preferred pharmacies. You've got to talk about that. Explain the gap again, even though it is in the video. I think it's really important to make sure you are verbalizing how the gap works. There's quantity limits, step therapy, getting an exception to the formulary. All of those things are in the formulary, and it is something that you want to talk through in front of your audience. And then, of course, the network for the medical portion as well. Not all doctors may accept this plan. Here's how you find who does. Now, for me, where I was selling in Iowa at the time, I knew that most doctors and all the hospital systems were part of the network. So I was able to kind of do a rundown of, Genesis, Unity Point, all part of the network. If your area is similar, you could say, cover most doctors, the hospital systems. But if you have a doctor who doesn't work at one of these places, here's how you look that up. And then explain how the star rating works, how CMS rates the plan, and what that overall star rating is for that particular plan. And I put this quote on the bottom. This is how I learned presumptive close for all of my appointments. All I need is your Medicare card and I can enroll you now. So you're just assuming that they want the plan. You can say that because it's not pressure close tactic. You're just assuming they want the plan because it's amazing. So you can say something like that to ask for the sale, but otherwise you don't want to say anything like you've got to do this or this is the best fit for you. That would get you tripped up on a secret shopper if they're present.
Courtney, this is all fascinating stuff. About how long are you thinking a seminar like this, like you're presenting? Is this an hour long, 45 minutes? What's your feeling on the length of this?
I have seen them go anywhere from 45 minutes to 2 hours. You know, if it's a large group, there are typically lots of questions, so you've got to talk to the whole group. If you've got it, the largest seminar I was at had about 85 people in it. I was not the agent. I was just helping because that's a lot of people to manage. And that one took about 2 full hours. And then we started doing enrollments after that. So just depends on how efficient you are with getting questions answered.
If someone, for example, I mean, if you're talking about the Humana HMO product and you're closing up and they start asking you a question, can you protect yourself with a scope of appointment if you want to delve into another product?
You cannot do that at the seminar. So okay. Great question. Thank you for saying that. So if somebody says, well, hey, I'm looking at this PPO also, do you mind talking to me about that? Let's get the scope and talk about it after okay. At a separate meeting, because in that presentation, you're only authorized to talk about the HMO.
Is there a hard and fast rule about when that presentation begins and when it ends? I mean, if somebody's walking out in the parking lot, I'm not trying to drag out the context here, but I'm just trying to make sure that our people out there understand that, we're all about compliance, and we really want to make sure that everybody understands that. Is there a hard and fast stop to that presentation?
So the start time is monitored by the secret shopper, but the end time isn't. I think the end of your presentation begins when you ask for the sale. When you close the presentation, you finish presenting, and that is the end of the presentation. But anyone lingering in the room, if somebody's hanging out, you're done with your seminar technically, but they're still there for that. They would need to leave the room, and I think it's around 15 minutes, and then come back separately. My recommendation is at that point, if you can, to get the scope of appointment and meet them on another day. But if they don't want to do that, if they want to talk about a different plan, I would give it a window of time and even meet them in a different location if you can. If there's another room or a lobby or somewhere else that you can enroll them in something else, you just want to make sure there's clear separation between the sales seminar and the sales appointment, because
thanks, Courtney. Thank you.
I know I rambled there a little bit. I have had that come up, and I took them into a different room because I did my seminar at our office in Bettendorf that used to be there, and there was a whole separate presentation room, and I took them about 15 minutes after I finished to a separate room. That way we could clearly delineate between the sales seminar and our meeting, our presentation. A little more about secret shoppers. I know this is scary to think that somebody who's going to directly report back to CMS is in the room. And I've seen the list that they fill out, the checklist that a secret shopper fills out. So typically, this is just us friends here, it's going to be somebody who looks like they might be Medicare age or have, a parent or somebody they care for that's Medicare age. That's what they're asking for with volunteers to do secret shopping. A lot of times they're, former SHIP counselors, or, they in many cases know what they're looking for. But if in case they don't, the checklist is very thorough and explains in detail what they need to watch for. And so here are the main things from that checklist. Of course, starting on time, and the materials that are given to them, if there are any signs present that they're all CMS compliant. And everything that is a marketing material, if it's CMS compliant, has a CMS approval number on it. So if it doesn't have that number, they're going to flag it. Playing the video start to finish, don't skip it, don't fast forward. If somebody starts talking during it or asks a question, stop the video, answer the question, and then resume so nobody's missing the content. Again, no absolute statements or pressure tactics. Cover the entire summary of benefits, including drug coverage network and election periods. Those are, of course, covered in the video as well, but it's a good thing to talk about to make sure they understand that December 7th is the deadline for AEP and so on. And everything else we've talked about. I mean, it's pretty comprehensive. That is where I pulled a lot of the information for this presentation, is from that secret checklist. So to market your sales seminar, how do you get people in the room? And I don't think there's any one approach that you should use. I think you should use all approaches. This slide is kind of a shortly compiled list of places that I would be already considering doing the educational events and informal marketing events. There are many people consider places like libraries and low-income senior housing, but there's definitely other places and people in your communities you can work with to help drive traffic or give you referrals, like a tax professional. They're likely asked about their health insurance of their clients all the time, but they're not licensed and certified to talk about it. Or maybe a property and casualty agency that doesn't add Medicare to their business. Realtors, they know when people are moving into town, so they could use that SEP move. So anything that's on this list, and I thought this was an interesting statistic that 17% of people retire at 66, but I think most Medicare marketing is aimed at people who are turning 65. So there's a huge subset of people that are ignoring all of those ads and retiring at 66. So if you work with a large employer in your area, the human resources department, they are a great resource to plug you in with their retirees. Now, that's my little spiel about community-based marketing. These types of places are also the people that can help you drive traffic or even host your sales seminar, like a library. I've done them at senior housing communities where I was already doing educational presentations. They are going to help you bring people in to the room if you have a good, strong relationship with them. Using multiple methods, as I mentioned. So I know this slide doesn't mean a lot, but it's more of a prompt for me in that using mailings and email and social media marketing, and we'll talk about each of these here in just a second. So firstly, marketing materials that are already approved. If you have not yet done so, I recommend spending a little time hunting around in the Marketing Resource Center. This is in Vantage. This is where we house all of our CMS approved content. Now, word to the wise, there's a lot in there. There's almost an overwhelming amount of approved content and in a variety of formats. So if you're having trouble navigating, please don't hesitate to reach out to one of us on the team. We're happy to kind of target exactly what you're looking for. So over on the right, if you're going to host multiple sales seminars or even just one, this is how we can do a mailer. We can do that as a postcard. There's also the ability to translate that same thing into an email. We have Facebook marketing as well in the Marketing Resource Center. And I'll avoid my soapbox here on the social media marketing and just say that of all of the people on Facebook in the United States today, which is a huge number, 41% of that is over 65. I know that's hard to believe, but seniors are on Facebook, and we have the tools you need to market your sales seminar on Facebook. And I highly recommend it if you're not considering it. Oh, here's my slide on it. So you've got to have a personal Facebook page, and from that personal Facebook page, you can create your business page. And here's just kind of some detail around how to create that compliantly. You're not going to say Courtney Stowe, Humana Medicare expert. That's not cool. You've got to say Courtney Stowe, insurance agent or insurance professional, something that's a little less specific to Medicare or a particular insurance company. You can also just put your agency as the name of your business Facebook page. And then from the Marketing Resource Center, you can pull posts right from there and post it on your business Facebook page. And those can also be branded for your sales seminar. If you're doing a virtual sales seminar, you can include the link and they just click on the link and register for the sales seminar and attend virtually. That is a possibility, but I'm really thinking people are wanting to get back in the field and back out into public. That's the vibe I'm getting from people so far today, but I'm happy to talk through it with each of you to kind of get a feel for what you want to do. Any questions? I think that is it.
Yeah, we do have a couple. Is it better to do an educational seminar so we can give a conceptual understanding on all the Medicare solutions we offer?
Yes, I think that that is an excellent strategy for marketing as we lead into AEP. If you're not doing educational Medicare today, I do highly recommend it. One, it's great for you for branding yourself as the Medicare expert in your community, but there's also a staggering number of people who need Medicare education. And I say that as somebody who just helped an agent through a really, really challenging member situation where the member has missed her enrollment date and is now uninsured in Part B, and there's nothing we can do about it because they were misinformed. So I see it happen all the time. The more Medicare education out there, in my opinion, the better. And you're right too. It really does let them know what you offer as an agent.
Courtney, is the rule hard and fast about only being able to present one plan at a sales seminar? Can you file for two plans?
You cannot. It is one plan at a time. So you'll want to make sure that you're only presenting one plan. If you're considering talking about more than one plan benefit option, I would consider it informal marketing. And then you're free to talk about whichever plans you want, but you can't sign anybody up.
You want to take us to the spot? I know this the seminar authorization course is out there. Can you again tell us where to find that in your
Absolutely.
website? Mm-hmm.
Yes. So if you are contracted with Humana, you have access to our Vantage portal. So to find that, you'll go to humana.com and click sign in the upper right-hand corner. If you haven't created your profile there, you can register for your profile. And if you have, you probably already know your username and password. Once you're in there, in Vantage, there's a lot of stuff in there, but you'll scroll down. Under the Education tab, you'll find Market Point University. I wonder if I can stop sharing and show you instead of, this might be easier.
Okay.
I'm going to pivot to my computer.
Real quickly, we've got another kind of a follow-up question on the educational seminar. When is it going to be okay to let business cards come into play?
Absolutely. So informal marketing and sales seminars, you are totally free to hand out business cards like confetti. In an educational setting, the CMS regulations have loosened, so you can, but typically speaking, you'll want to wait until somebody is asking you for your information, which they will. Usually I let off my presentations by saying, I am a licensed insurance agent, but that's not what I'm here for today. I'm here to educate you on Medicare. If you have questions about your plans, happy to talk about it. Come see me after. And then it puts it in their brain to come talk to you about their benefits.
I know you and I have chatted about this regarding your participation with a broker's seminar. Are we limited to the number of presenters at any one time?
Everybody who is certified to present at a seminar, is probably okay to speak, but every seminar is filed for one speaker. So ideally, you'll have one person presenting the benefits. Can you see my Vantage screen right now?
No, we're still seeing the certification screen.
Okay, I'm going to stop sharing totally. Let me know if that works.
Yep.
Okay, so if you're not familiar with this already, this is my main Vantage home screen. This is what yours will look like. I was an agent, so this is an active book of business, and so it's exactly like what you'll see. I mentioned the Marketing Resource Center. This is where you're going to find all of your marketing material for everything to do with Humana. But to find the certification course, we're going to come down to the Education tab and go into Humana Market Point University. And I should have done this on Chrome. It works better, but it'll think about it and load it up for me. This is where you come to do, you can actually learn quite a few things here in Market Point University, but certification is the most common use for this. This is also where you will go to be able to utilize our Facebook marketing. There is a class. It's not wanting to finish loading. My computer is just being very slow, so I apologize for that, but it'll come up here in a second. There's a big,
quite all right.
Thank you. I appreciate your consideration for my technology. There's normally a big search bar right here. Just type in the word seminar, and that seminar authorization course will be the option that pops up.
Okay, all right. Well, I, for one, have found this to be an absolute wealth of knowledge when it comes to doing a sales seminar. I don't want anybody out there to have cold feet with this, because I do think we've got several brokers out there that have really escalated the number of clients that they have gathered during AEP doing these sales seminars. I think it's well worth the time and the effort that we put inside this. Courtney, would you be able to sometime in the future maybe follow up with a half a webinar with us, just to catch us up on maybe some of the new offerings out there that Humana after the July date?
Absolutely. Yes, okay. I would love to come back and talk about what our plan year looks like for 2022. And I do appreciate you saying that it is well worth the effort. I know I am, when I present about seminars and talk about them, I'm pretty rigid about it, and it can feel a little intimidating. It's just because I don't want you to ever get in any hot water. So I will be really compliant, really overly so, and just to make sure you don't get stuck, but I'm here for you.
Yeah, we definitely appreciate the safeguards. We want to make sure that we stay inside the field of play when it comes with CMS and compliance. And I often tell our people that the compliance is there for our protection. It's there for our own good. Mm-hmm. And it kind of keeps the bad people out of our business anyway. So I look at compliance as a positive as opposed to a negative, just as long as we stay inside a few set rules.
Agreed. Yeah. Same here, and we'll work together to help you get your sales seminars set up, help you market them, and help you stay in line. And if you do want us to be there, somebody from the Humana team, we're happy to do so. We can even, if you're really worried, we can even present for you.
Yeah.
So that's, I was an agent myself, so I definitely know how to present a plan, and if it's something that you want to do.
We got one more question bubbling up here. We got actually more than that, but here's a good question that people are concerned with. Sometimes they can split commissions if there's a sales presentation going on, even though it's filed, say, under John Hockaday's name. If John and his partner are splitting the business, there was still a capacity to split commissions. Is that correct?
Sure, yes. So you can either enroll everyone under one SAN and then split the business after that. Humana doesn't split the business, but you can on your end, or you can split the enrollment applications. So one agent can take half, the other can take the other half. However you want to do that, as long as both are sales seminar certified.
Well, Courtney, this won't be the last time we're going to have you on. We certainly appreciate it. John, you got anything to add?
Thank you, Courtney. Thanks a bunch.
Thank you all, and I appreciate all of you for being here. I cannot wait to roll out our benefits for next year. So hope you all have a wonderful rest of the day.
Thank you.
Courtney, I've always appreciated your response. We'll be back in touch.
Awesome. Thank you.
Thanks to everybody.